So I would request Dr. Lakshmi C. She's a consultant at Abate Al Salama and pediatric ophthalmologist consultant, and to speak on right incision, limbalfornixothers or others.
So when we come to incisions in squint surgery, is it important to know what type of incision to choose? So before that, I would like to know if there are any postgraduates here in this room. Any postgraduates? Or yeah, at least 3 are there. Fine. So we think about 4 scenarios. What are the different types of conjunctival incisions? What are the advantages of these? And when do you opt for a particular incision? So you might have, all of you must be knowing that there are mainly 3 types of incisions. One is a limbal incision, the second is a Parkes cul-de-sac incision, and the third is a swan incision over the muscle insertion. And most commonly we use the limbal incision or the cul-de-sac or fornix based incision. And in certain scenarios, we even go in for a minimally invasive strabismus surgery, which are basically modifications of the fornix-based or the limbal incisions, and made in such a way that it can be converted into a limbal-based or a fornix-based incision if the necessity is there. So this is how a limbal incision is made. So there is a, initially a conjunctival incision is made. First a nick is made at the limbus around 1.5 clock hours here, it's extended, and then we make wing shaped extensions for the limbal incision. This is the fornix incision, in which initially we need to rotate the globe. Suppose this is a medial rectus which we want to operate. We rotate the globe supratemporally, and then we identify the clear space between the medial rectus and the inferior rectus, a relatively white area, and we need to make the incision after tenting up the conjunctiva like so. Initial incision is made, and the second incision is made vertically in the tenons right down to the sclera to expose the bare sclera. So we get access to the medial rectus and the inferior rectus in this case. So this is how fornix incision is made. Limbal incision, we open up and directly we can hook out the muscle and proceed with the operation. In a fornix based incision, initially this has been described in Helveston. Most often we put it parallel to the lid margin. The incision is made approximately 8 mm from the limbus, and after doing the bare, coming to the bare sclera after incising the tenons, the muscle is hooked like so, and the tenons above the muscle is reflected by another hook, and the sclera, the tenons here should be incised so that the superior pole of the muscle is also exposed. So we get a clean plane of incision. So these are the limbal and fornicial incisions. This is for obliques, for recti, and the limbal incision. So what are the advantages of each incision? Advantages and disadvantages. So fornix incision, the main advantages, the incised tissue, this is the rotated globe, and here is the incision that we make, and the incised tissue will slide behind the lid when you release the globe. So that will be masked by the lid, or it will not be seen outside. And it has a better appearance, a better plane of dissection, and there will be less of scarring. Suturing, most cases, will not be needed, and it is a better option if 2 adjacent muscles are being operated. And conjunctival recession may not be possible in such cases. If you are recessing the muscle and want to do a conjunctival recession, it may not be possible in a fornix based incision, but these are the advantages. The second thing is, coming to a limbal incision, we will get a very good exposure because we are incising the conjunctiva in a very large area. It needs very less assistance. fornix based incision needs a better assistance and experienced assistance for good results, because otherwise your exposure will be very less. In a limbal incision, you get more of exposure. It needs suturing. Definitely it needs suturing. So the sutures will be visible in the palpebral fissure area. Whereas in a fornix based incision, it will slide back behind the lid. It has better option in re-surgeries. When we want to do an eye which has been operated earlier, this will be better because it is already a scarred conjunctiva and our planes may not be as clean as a first time surgery. So re-surgeries, better we have to opt for a limbal incision. We get good exposure. Conjunctival recession is possible in a limbal based incision. So when do you opt for, so I want the PGs to answer this question. You are operating, you are a squint surgeon, take it for, and you are a squint surgeon. You are operating in an unfamiliar setup with a new assistant. What type of incision would you prefer? Limbal based because it is easier rather than going in for a fornix based. But ultimately it does depend on your comfort. If you are trained in one way, you tend to go in that way, and if you are trained in fornix based incision, you tend to go in that way. But in certain situations with an unfamiliar setup, it might be better to go in for a limbal incision. A high myope with exotropia who is constantly wearing a contact lens, he cannot move without a contact lens. You are doing surgery and they want to use the contact lens within the next few days. What type of incision would be better? For the contact lens fit, you want the limbus to be undisturbed. So which fornix incision would be better in such a situation? This is a consecutive exotropia case in which you are planning a medial rectus advancement with a lot of scarring expected. Which type of incision? It's a limbal incision because better exposure and you will not lose the muscle. Restrictive strabismus. In a which one? Can I get? Limbal. Why? The muscle will be very tight, good exposure is needed, and you might need to recess the conjunctiva in certain situations. So this is a recess resect procedure for an intermittent exotropia in a 6-year-old child, no other complications, routine surgery. In your regular OT, what incision would you prefer? Anything according to your convenience. You can take a fornix also because it won't be a problematic issue. It's a routine type of case. So thank you. So that's all about conjunctival incisions.